Iron tablets can be beneficial for individuals who have been diagnosed with iron deficiency anemia or have been advised by their doctor to take iron supplements. However, taking iron tablets without a medical need can be harmful. Here are some reasons why you should not take iron tablets without medical advice. 1. Iron toxicity. Taking too much iron can be toxic, leading to symptoms such as nausea, vomiting, stomach pain, constipation, and even organ damage in severe cases. 2. Interference with other medications. Iron tablets can interfere with the absorption of other medications, such as antibiotics, thyroid medications, and some antacids. This can reduce the effectiveness of these medications and may lead to other health problems. 3. Masking other medical conditions. Taking iron tablets can mask the symptoms of other medical conditions that have similar symptoms, such as bleeding in the digestive tract or cancer. 4. Gastrointestinal side effects. Taking iron tablets can cause gastrointestinal side effects, such as nausea, vomiting, constipation, and diarrhea. These side effects can be uncomfortable and may lead to other health problems. Therefore, it is important to consult with your healthcare provider before taking iron tablets. They can help determine if you need iron supplementation, and if so, what type and dose of iron supplement is appropriate for you. Your healthcare provider can also help monitor your iron levels to prevent iron overload or other potential complications.